I'm Dr. Lauren Hedde, and my business is Direct Doctors. This is a primary care practice that's an alternative option for patients who are frustrated with the typical practice and are looking for a new choice for them. And basically what I offer is, for a low monthly subscription fee, patients have access to me as the doctor directly. They have 24/7 access to my cell phone and email. They can get in and be seen same day. I even do home visits. And we're able to really form a much more in-depth patient-doctor relationship through this setup. So far the business has been successful. I've just been practicing in the North Kingstown area for about a month and a half, but I have had a lot of interest, and a number of patients and families have already joined the practice. So I decided to start this business both from a doctor's perspective and a patient's perspective. As a physician, I was frustrated with the typical primary care practice where I was always looking at the clock, I was always trying to rush through patient visits, and I felt like I really wasn't spending the time that I thought was necessary with patients, always asking them to come back another time, and really being dependent on the fee-for-service model, where in order for a physician to be paid, they have to bring a patient back and see them again so they can bill their insurance company. And I wanted to break out of that model and offer something different. From a patient's perspective, I felt frustrated. I have a little girl, and I felt that when I needed for her to get in because she was sick, I had to spend a week waiting for her to see the doctor, or when I called, I wasn't able to talk to her doctor. I could only talk with a secretary or a medical assistant. And I felt like something with a lot more direct access would be great, not only for patient satisfaction, but also for satisfaction for me as a physician, being able to really spend time with patients and get to know them and feel that we were putting in the time and energy that was necessary to allow patients to feel that they could really develop that relationship and really feel like their issues were being addressed. Down the line, I would love for this to be a practice where there are satellite offices throughout the state, so that any patient in any part of Rhode Island who is interested in having this alternative choice for primary care practice can find one that's close to them.